Welcome to this module, and now we will be looking at moving and handling. How you move them around, how you handle them. Yes, I know some of you have been helping to carry people from one place to the other, but what are the techniques you use? What are the methods you use? How do you do them? So the way you carry somebody, some of you will say the way I go jack them. The way you jack people will really tell if you are a professional or not. So moving and handling is what we're going to be talking about. But first of all, I need us to understand what is called body mechanics. Body mechanics. Body mechanics simply means how you position your body when you are performing a procedure. Okay? How you position your body when you are performing a procedure to avoid injury to you and also to the service user. So there are ways you will stand, there are ways you will lift, and it's going to cause a problem to you. So body mechanics is extremely important because record has it that most of the illnesses that is sustained by caregivers or health workers has to do with severe muscle strain. Most times you hear that a health worker is feeling ill or is feeling sick. It has to do with severe muscle strain. All right. So we need to be very careful how we perform the procedures that we perform to avoid injuries to us and also injury to your service user. Now, the way you bend, the way you stand, the way you turn, it is extremely important, right? You need to be mindful of your body mechanics to avoid some of the injuries that could happen to your muscles, your bones, to your nervous system. You need to learn how to maintain balance. You need to learn the right posture. You need to learn how you align yourself, how you move, and all that when you're transpiring or repositioning and positioning a client or a patient. Okay, so number one is you need to always keep the center of gravity low. Okay, keep the center of gravity low. You don't want to cause issues that will not keep you stable, or you don't want to stand in a position that you are not balanced yourself. Now keep your back straight at all times. Your back should be straight. Do not bend your back. You do not for any reason, your spinal cord shouldn't be bent. Keep your back straight. Bend at the knee and the hip, not at your waistline. Now, this is something we do so often. You see so many times when we bend, something falls on the floor. You see us bending like this and it's affecting our waist, but you need to learn how to bend on your knee this way and how to bend, from your hip side, on your knee side, and not on your waist. Is that okay? Keep your feet apart for balance. Keep your feet apart like this for balance, side by apart, not wide apart. Keep your feet apart because you want to be balanced. Now, when you keep your feet apart, you're balanced to the left and to the right. But for you to gain balance forward and backward, one foot should be slightly ahead of the other. So when your feet is slightly ahead of the other, now this gives you balance front, back, then left and right. Because when it's like this, your left leg is wedging you forward while the right leg is wedging you backward. So keep your feet apart for balance, but move one foot slightly ahead of your other. Turn with your feet and not with your waist. Turning with your waist this way, every time you're lifting, you're turning with your waist, it causes a problem. So it's better to flex this way instead of turning with your waist. So your leg or your feet should be the one doing the turn and not you. All right. Now, objects you want to lift should always be close to you. All objects you want to lift. Mr. Morris might be, relaxed on the wheelchair. You want to bring him a little bit close to you before you can lift him. Don't just jack somebody when they're in that very comfortable, relaxed position. So bring objects close to you before you lift. And before any lifting, you need to count. So you say something like, Mr. Jones, at the count of 3, I'm going to be lifting you from the wheelchair to the bed. Is that okay? At the count of 3, 1, 2, 3, then you lift. So that puts everybody ready for the movement, right? Mr. Morris is ready. You are ready. You have to count before you lift. Now, do not stretch, rather climb. If something is on top of the cupboard, you don't want to stretch because you don't know if what you're bringing out, there are some liquids out there that might fall on you. You don't want to stretch. Rather, bring a stool to stand, climb, and easily pull out what you want to pull out. Then do not lift any object that is heavier than you. If an object is heavier than you, you might need help doing that, or you can use some of the equipment we're going to be teaching in this module that you can use to transfer them. So we have two types of transfers. The minimal transfer and the maximal transfer. Minimal transfer and the maximal transfer. So the minimal transfer is when you apply minimal effort. You are not doing so much. So when do you need to apply minimal transfer? There are chances that Mr. Jones can still work. He can still stand up by himself. He can actually move to the bed by himself. But because he has just had a surgery, he might be encountering extreme pain, or maybe because of medication, he's feeling dizzy. You need to just hold him a bit. You are not doing so much, minimally. So you tell him, Mr. Jones, at the count of 3, I want you to stand. He is the one that stood, but you're just grabbing him. You're just assisting him to stand. That is called minimal transfer. The patient can support themselves. You are just giving a hand. You're not doing so much. You're not the one lifting them totally. But when it comes to the second one, which is maximal transfer, you are applying maximal effort. You're carrying the patient totally and absolutely. The patient cannot do anything to assist you. Possibilities are that he or she is paralyzed, or they are sleeping, they have not woken up from some kind of, medication they have gotten, so you're the one to carry them. They cannot assist you in any way. There's no need to count 3 because they don't even know what is happening, right? But when they are conscious, yes, you have to count 3 so that everybody is prepared. But if they are sleeping, you are only going to be counting 3 if you have a partner. Somebody is helping you to lift him, so you're telling your colleague, okay, are you ready for this? At the count of 3, we're going to be moving Mr. Jones from point A to point B. All right, so maximal transfer, you are carrying him totally, you are carrying him absolutely. There is nothing he or she is doing to assist you. The patient cannot help you, the patient cannot assist you. You are the one doing everything all by yourself. And remember, while you're doing these procedures, while you're doing this lifting, you need to be mindful of your body mechanics. Is that okay? So there are some things you can use to assist you in the process of performing your transfers, minimal or maximal transfers, right? So we have what we call a gait belt. This is a gait belt. You put it round, the waist of your client, and you can use it to lift him up and move him around. So you use a gait belt when you do not want to have a direct contact to the skin or with the skin of your client. So instead of grabbing him on his skin, on his hand, you want to just put the gait belt and grab him. So gait belts assist us in performing our transfers, and most of the time it is done to people that have a fragile skin, whosoever that their skin is already fragile, or most people change color when you hold them so tight. So you use a gait belt to avoid having a direct contact to their skin. Then we have a transfer board. We have a transfer board that can be used when somebody's seated or when somebody's lying. So the transfer board basically bridges the gap between where you're moving them from and where you're taking them to. Let's assume you want to move them from the wheelchair to a car, okay? Because of the handle of the car door cannot open so wide, so you don't have too much space. So once you place the wheelchair, 45 degrees from the car, there's always that space in between. So you want to put a transfer board in between, then you can slide them from the wheelchair even onto the car, and from the car to the wheelchair. The same thing can happen when they are lying down. You want to move someone from a bed to a stretcher, or from a bed to another bed. Maybe they are changing rooms or something, from one bed to the other. When you place the 2 beds in between, there's always a space, there's a gap in between the 2 beds. So you want to place a transfer board in between so you can easily slide them from one place to the other. Then we also have the slide sheet. The slide sheet is used to slide them, with the transfer board from one surface to the other, like you're going to see on the videos on the screen. Then we also have a hoist. Okay, a hoist is used to carry heavy people. Some people call it a crane. Okay, it's not a crane, but it looks like a crane. So it works like a crane. So it just lifts you, it jacks you up there from one place to the other. And in the practical class, you're going to see all that and how it works. So there are things that will help you during the process of transferring somebody from one place to the other. You can use a gate belt, you can use a transfer board, you can use a transfer sheet, or you can also use a hoist for people that are extremely heavy. You won't be able to leave them by yourself. The hoist will help you to lift them from one place even onto the other. So in the course of this module, I have mentioned so many times procedures. You need to understand what that means, okay? So everything you do on your client or on a patient or on a resident is called a procedure. If I want to bait a client, baiting is a procedure. If I want to help him move from one place to the other, it is called a procedure. Everything I do is called a procedure. Everything you will be doing at work is called a procedure. You want to help with their oral care, it is a procedure, okay? Then on the other hand, the things we use to carry out the procedures are called supplies. They are called supplies. So if I want to perform oral care, which I have mentioned before, that oral care is brushing of teeth, what are the supplies you will be needing? Toothbrush, toothpaste, face towels. If you're not going into the bathroom, bowl, water. Okay, so what you use to perform a procedure are called supplies. All right, then the activity itself is called a procedure. Okay, so when you are performing a procedure that has to do with lifting, moving, handling, you need to be mindful of your body mechanics so you don't injure yourself and you don't give yourself a reason to go to the hospital. I hope and believe you've gotten value from this module. I look forward to seeing you in the next one. Bye for now.